Have you ever thought about what it would feel like to drown, but on dry land? Where your own lungs are filling with fluid, and every single breath is a desperate fight? Well, today, we're going to go inside the life or death medical playbook that paramedics use to pull someone back from that exact brink, step by critical step.
Yeah, it's a terrifying question, isn't it? Your chest gets tight, that primal panic starts to set in, and every gasp for air feels like a losing battle. Now, for most of us, thank goodness, it's just a fleeting, scary thought. But for thousands of people, it becomes a sudden and absolutely overwhelming reality.
So, what is this? Well, medically, the term is acute pulmonary edema. But the feeling, the feeling is much more primal. It is quite literally like you are drowning from the inside out. Okay, so let's put ourselves in the moment. It all kicks off with a 911 call. Someone can't breathe. From the second those paramedics get on scene, they are following a very precise protocol. So let's walk through it with them. So what's usually behind this? 9 times out of 10, the culprit is something called congestive heart failure, or CHF. Now, think of your heart as this incredibly powerful pump. Well, in CHF, that pump is getting weak. It just can't push blood forward the way it's supposed to. So what happens? Fluid starts to back up, and the first place it floods is into the delicate air sacs of the lung.
All right, so the paramedics are on scene. They walk through that door, and they're not just seeing someone who's struggling for air. No, they are detectives searching for a very specific pattern of clues that tells them exactly what's going on inside that person's body.
And these are the big ones they're looking for. You know, with a stethoscope, they can actually hear crackling in the lungs. That's literally the sound of air trying to bubble through fluid. Those swollen neck veins, that's like a traffic jam in the circulatory system, a dead giveaway that fluid is backing up. And that pink, frothy sputum, that's a classic, textbook sign that fluid is being forced right out of the blood vessels and into the lungs. Every single clue is pointing to one thing: massive fluid overload. But hold on, a great paramedic, or any good clinician for that matter, doesn't just jump to conclusions. Now comes the real detective work. They need to confirm their main suspect, while also making sure they haven't missed another equally dangerous culprit.
This means they start asking some really important questions. Has this ever happened before? Do you have a history of heart failure? They'll even glance at the medicine cabinet. Spotting a prescription for a water pill like Lasix is a huge clue. It basically confirms a history of fluid problems and makes the case for CHF that much stronger.
In medicine, this whole process has a name. It's called a differential diagnosis. So while CHF is absolutely the prime suspect, they have to consider the other possibilities. Could this be a really bad asthma attack? Maybe pneumonia? Or something really dangerous, like a blood clot in the lung called a pulmonary embolism? Ruling these other things out is just as important as ruling CHF in. Okay, so once they're pretty certain they're dealing with fluid overload from heart failure, boom, the playbook opens. And these aren't just guesses. This is a rapid, precise sequence of actions, all designed to immediately support the patient and turn things around. All right, let's break this down. First things first, oxygen. The goal is to get their blood oxygen saturation back up to at least 94%. At the same time, they're hooking up a 12-lead ECG to get a really detailed electrical picture of the heart. Then comes aspirin, which helps stop any dangerous blood clots from forming. And finally, if the patient's blood pressure is high enough, they get nitroglycerin. This stuff is amazing. It opens up the blood vessels, which is kind of like adding extra lanes to a highway during a traffic jam. It just makes it so much easier for that struggling heart to do its job. But what if that's not enough? You've done all that, but the patient is still gasping, still fighting, still feeling like they're drowning. Well, the protocol has an incredibly powerful next step for this exact situation. That's when they bring out a real game changer, a machine called CPAP. Now, you might have heard of this for treating sleep apnea, but in an emergency like this, it is a lifesaver. It basically forces pressurized air into the lungs, which does 2 amazing things at once. First, it props open those little air sacs so they don't collapse, and second, it literally pushes the fluid back out of the lungs and into the bloodstream so the body can finally deal with it. Now, you don't just slap this thing on. It's applied really carefully. First, they have to make sure the patient's blood pressure is stable enough. Then they start with a really gentle pressure, just a light, constant puff of air, and they slowly increase it if they need to. For the patient, the relief can be almost instant. It is truly the difference between drowning and breathing. Okay, so while all of this life-saving treatment is happening,
Remember that 12-lead ECG they did at the very beginning? Well, it's about to reveal something absolutely critical, and the answer it provides is going to determine everything about what happens next.
And it all boils down to one single, massive question. Is this just a bad episode of heart failure, or is it being caused by a major active heart attack right now? That ECG holds the answer, and that answer creates a huge fork in the road for this patient's care. What they're hunting for on that printout is a specific pattern called STEMI. It's this unmistakable signature on the ECG that basically acts like a giant flashing neon sign. It tells them that a major artery supplying blood to the heart is 100% blocked. This isn't a guess, it's confirmation of a massive heart attack in progress. And spotting that STEMI, it changes the entire game. I mean, literally everything. If there's a STEMI, the protocol is crystal clear. You do not go to the nearest hospital. You go to a specialized cardiac center, a hospital that has a cardiac cath lab ready to go 24/7 to surgically open that blocked artery. If there's no STEMI, then the nearest appropriate hospital is fine. This one finding literally changes the ambulance's destination and can change the patient's entire outcome. Wow. So let's just take a step back for a second. We've just walked through a really complex, super high-stakes medical emergency. But the real hero of the story isn't any single drug or machine. It's the system itself. I mean, think about the scene. It's pure chaos, right? There are alarms going off, you have a person fighting for their life. There is absolutely no room for guesswork. And that's what this protocol is. It's a roadmap. It ensures that every single patient gets the same high standard of care based on proven science every single time. See, none of this is random. It's not about trying things and seeing what sticks. It's a deliberate, meticulously designed system. From that first puff of oxygen to the final choice of hospital, every single step is part of a life-saving checklist. It is the ultimate playbook for turning chaos into control. And that really leaves you with one last question to chew on, doesn't it? We've just seen how this one protocol can save a life in one specific emergency. But protocols like this exist for everything, from strokes to major trauma. It just makes you wonder, in our world of incredibly complex medicine, how many lives are being saved every single year, not by some miracle cure, but by the simple, profound power of a checklist?